Hey everybody, this is Spencer from Gracepointe Healthcare walking you through how to sign up for patientfusion.com or the patient portal so that you can have a better experience with your provider by messaging them directly any of your medical questions, receiving messages from your provider, looking at your previous lab results, requesting appointments on the client, as well as viewing other health information that Gracepointe Healthcare may have on you as a patient. So we have a fake patient profile here, Joe Snuffy, and those who are in staff at Gracepointe Healthcare, either after your initial visit or when you come in, if you have not already been signed up for the portal, will see this box here, Patient Portal Access, and they will ask you if your email is up to date as well as your phone number, and they will click this button, Invite to Patient Portal, to sign you up. So for Joe Fake Patient Snuffy, we have his email down as info@gracepointhealthcare.com, and his phone number is the office's phone number, 615-599-6868. So we're going to send an invitation here, and we're going to head to his email address and see if that email has come through. Okay, so his email has come in here at info@gracepointhealthcare.com. We can see that his records are ready to be accessed. Now, if you're accessing this email through Gmail, Yahoo, Hotmail, whichever email service you use, likely it will display a red button that says Access Your Records, and you would click on it to go and verify your identity. Here, it just provides the links that would be within the red button there, so we're going to click the link here to access Joe Snuffy's health records. So you'll receive two options here, either to enter a PIN that you've received from your doctor or to request a security code sent to your phone. Whoever signed you up for Patient Fusion in the office will likely just tell you to select request security code via phone, but if you have to enter a PIN received from your doctor, if you have a printout sheet, that PIN will be on there. You'll click that, then you'll put in your date of birth as well as the PIN you received from your doctor to verify your identity. But for the purposes of this video, we'll go ahead and request a security code via phone. And Joe Snuffy's birth date, as it says on his chart here, is January 1st, 2000. So we'll go ahead and put that in here. And we'll enter in the phone number that's on file for the patient, which is 615-599-6868. And we'll have that sent via voice since it's the business number, but you can have that code sent either via text to your mobile device, or you can have them call you so they can read out the code to you. So we'll go ahead and request that code, and a phone call should be coming in within 2 minutes. Alright, so we have that 5-digit code verified here, and we'll click on Check Code. And the identity has been verified on the patient. So what we'll do is, if you're a new patient and you haven't used Patient Fusion before, likely what you will have to do is click on Create a New Account and put in your information here. So as a new patient, you'll get a security question here. We'll just say, for what is your favorite meal, we'll say tacos. And we'll put the patient's first and last name. We'll put Joe Snuffy. His phone number is entered in there, and we'll set a password for the account. As it says here, your password has to be a minimum of 8 characters. It has to have 1 uppercase letter, 1 lowercase letter, a number, or a symbol. So we'll set the password here for Joe. So we'll click on Create New Account. Now, it says here the username has already been taken. If that prompt comes for you and says it already has been, that means you've previously registered with Patient Fusion under the same email address. So what you need to do is you need to go back and click on Link to an existing Patient Fusion account. And you'll put in the email address here and the password that you set, or go through the forgot password steps. So we'll go ahead and link Joe Snuffy's records here. And once you've logged in, you click on Link Records. And the registration is complete. You'll just log in one more time. And here you are in your client for Patient Fusion. You'll go to Health Records here to see your lab test results whenever they come in, any previous diagnoses that your provider has given, any medications that you're on, any previous immunizations you've had, any documented allergies, procedures you've had in clinic, any care plans that you're on, your previous visits, your vital signs, as well as any previous medical history. To request an appointment, click Appointments, click Book Appointment. Make sure you select your preferred provider, Robert or Crystal. In this case, we'll select Robert. And just look at his schedule for the next week of when he is in office and times you can request. And you could put time preferences here, as well as the reason you are coming in and if you've seen this doctor before or not. And once you put in that request, either a staff member in Gracepointe Healthcare will approve of the appointment, or they will call you back to let you know that that time slot conflicts. They may call you back, or they may just deny the request in their online Practice Fusion client. To send a message to your provider, just click on Messages, click New Message here in the top right corner, and make sure to select either Robert Tomset or Crystal Lynch, or whichever provider you saw during your visit. Make sure you select them for your new message, because if you send it to any providers that you did not see, such as Edward Leischner, or in this case Beck Bledsoe, those messages will not be read, as those are providers who are not actively on Practice Fusion for Gracepointe Healthcare. So your message won't be seen unless you send it to either Robert Tomset, Crystal Lynch, or the provider you saw in office. You can also see the providers that are in your clinic here, as well as you can look at your profile and edit any information that you have here under account settings. And that should be it.